You're watching the Valley's most watched television station, WKBN 27.
Welcome back. It's time for our Live at 5 segment. Joining us today, Dr. Michael Sevilla from Salem Community Hospital. We're talking about autism, which is a disease that we seem to be hearing a lot more about these days. And also, we want to let people know that April is Autism Awareness Month. So we want to kind of get the facts out and first of all, talk about the impact of the disease in general.
We're learning more and more about autism, especially about the numbers now. We're finding now that the current research now says that about 1 in about 110 children are affected by autism, and it's even more common in boys.
Interesting.
And when you look at total numbers, about 1.5 million are on the autism spectrum, which means that when a kid gets diagnosed with autism, it's not a specific set of symptoms, which we'll talk about in a little bit. But you see other names attached to autism, like Asperger's syndromes and PDD. Pervasive developmental disorder. So
those are all on the spectrum somewhere.
It's still on the spectrum somewhere. Yeah, which that basically means is that you may not have all the symptoms, and there may be symptoms of varying degrees.
So when we talk about symptoms, what are the symptoms? What are signs that as parents we would look for?
Yeah, things to look out for are things like little or no eye contact, repetitive speech, minimal social interactions, awkward type movements. You may have heard of kids with autism having flapping of the hands or moving of the neck and things like that that are not normal to other kids. So those are definitely red flags to check with your doctor about, to say, hey, is there something else that's going on here?
Are there certain ages that it starts to come up, you know, that you might realize, you know, if they're 3 years old, would you think that they would be past a certain point of getting it, or can it come up at any time?
That's the thing with the spectrum, is that some of the diagnoses of autism, they're diagnosed earlier, some of them are diagnosed later, so it can be varying degrees. So parents would definitely know if there's something not right, definitely check with your doctor about that.
They would definitely talk about. What about, we hear so much about the controversy when it comes to immunizations. What are the facts about that? Yeah,
there was a study that came out in 1998 that said that there could be a link to autism. That has been debunked. Autism is not caused by immunizations. Thimerosal, which is in immunizations, does not cause autism. So definitely, there's not a link there right now.
So definitely, you know, if you are fearful, you know, it's valid. You know, it's valid to be concerned about things, but talk to your doctor, and you can figure out the right choice to make. So thank you very much. We appreciate you coming in. And remember, you can always get more information on our website at WKBN.com. We'll be right back.